Health this morning. New research suggests sunscreens with an SPF of 30 reduces the risk of melanoma. Dr. Adam Mamelak is a dermatologist at St. David's North Austin Medical Center and here in the studio with us. Thanks so much for being here.
Absolutely, my pleasure.
Tell me a little bit about this study and what it means for dermatologists across the country.
Well, it's very interesting. We've known for a long time how the sun can damage our skin and how UV or ultraviolet light can damage the skin. We've known for years that it can cause mutations in the skin, and these mutations ultimately can lead to skin cancer. But we've never actually had a model where we could see how sunscreen can directly intervene. And this is the first time that's happened. You know, for years, UV light has been bad for us. We know that women that tan get skin cancer at a much higher rate than women that don't tan. We know that over the years, older people that live in sunny climates get skin cancer at higher rates than people that don't live in sunny climates. And we always say, cover up, you know, wear sunscreen, it's good for you, it's going to protect your skin. Up until this point, we've never been able to link that specifically with how that would decrease melanoma. So here's a researcher that discovered a mouse model that these mice just get melanoma. They're genetically programmed to get melanoma over time. And what he showed is that if he coats these mice with sunscreen and then exposes them to ultraviolet light, the mice that have sunscreen on don't get melanoma as much as the mice that don't. I mean, this is pretty impressive. It's very, very impressive.
And melanoma is deadly.
Melanoma is one of the most aggressive forms of skin cancer. So although it's not the most common, it is one of the ones that we worry about the most.
And we are entering Skin Cancer Awareness Month.
Absolutely.
How important is raising awareness about skin cancer?
Well, I like to say that May is Melanoma Awareness Month and Skin Cancer Awareness Month, but for dermatologists, it's all year long. This is something that's very important. It is one of the only cancers that is still on the rise in America. We are seeing it in young people, certainly in older people that have lived in the sun for a long time, but in young women especially. So telling people to check their skin, getting them familiar with their moles, telling them to check their spots, and having them evaluated by their doctor, their dermatologist, is extremely important. One of our best strategies for curing people and saving lives is to get them checked early.
And so back to sunscreen.
Yeah.
It's something that people think about when maybe they go to the pool or the beach or spend a lot of time outside, but you say every day.
You know, we're in Austin. I mean, this is the Sun Belt. So we all get stuck on Mopac with our arm out the window for half an hour longer than we want to. We have these exposures that we just can't plan. So I tell people to cover up. I tell people to put their sunscreen on before they leave the house in the morning. Use it like an aftershave under your makeup. These are the best things. And that way, if you do have one of these unexpected exposures, at least you have some protection.
And you stress the importance of kind of making that part of your morning routine so you don't forget about it. But for folks who may not have put it on in the morning, is there a kind of golden rule, a good time that they should apply it before they're outside and exposed?
So with a planned activity, we always say put it on 15 minutes before you leave the house. But, you know, what can I say? I'm a dermatologist.
Yes.
I keep a bottle of sunscreen in my glove compartment because you never know. Keep a bottle in your golf bag.
Well, now you can get little mini bottles.
Absolutely.
And keep it handy. And again, just going back to raising awareness, what would you stress folks to do to become more aware?
You know, we recommend that people kind of get to know their skin. So check yourselves regularly. Check yourself once a month. You know, take a mirror, look at your back, get your spouse to help you, look in the areas where even the sun doesn't shine. And then see your dermatologist. We recommend that everyone gets a skin check at least once a year by a skincare professional or by a healthcare professional to make sure their spots are okay.
Dr. Mamelak, thanks so much for talking to us about the importance of sunscreen in this new study that looks to be promising for future research.
Thank you so much.
Thanks for your time.
Thank you.